Pregnancy test is positive. Congratulations. Or not.
Aww.
Well, if you're contemplating an abortion, do well to listen to my previous episode on life before, during, and after an abortion to know what it entails. But for the newly pregnant that are keeping their babies, welcome to the world of pregnancy. I am Dr. Obelson, Triple F, where we discuss women's sexual, physical, and mental health. So do well to hit the subscribe button and turn on your notification for a fresh episode every Friday at 8 p.m. If this is your first pregnancy, we will call you a primigravida. Please remember your last menstrual period, which is the first day of the last period you saw, because this will be required to calculate the date of your baby's arrival, known as the EDD, estimated day of delivery. If this is your first pregnancy, I will encourage you to stay with me till the end of this video to find out how your 9 months pregnancy may feel like from day 1 to delivery, and also what is expected of you during antenatal care visits. You may have fears on what to and what not to do and expect from this life-altering experience, especially in this coronavirus pandemic and lockdown in some states. So I'll try my best to allay your fears and explain to you what you should expect from your first month to your 9th month of pregnancy. All things being equal, pregnancy requires that you register for antenatal care, where you'll be seen by a trained healthcare provider who takes your history and examines you, runs some basic tests and scans at certain intervals to monitor you and your baby's growth all through the pregnancy. Well, we're in a pandemic and things are obviously not equal, as most of you will be scared to even visit the hospital. The virus is still new and researchers are still learning on how it spreads. As at this time, adequate information has not been shown if the mother can transmit the virus to her unborn child during pregnancy, delivery, or even breastfeeding. I will encourage you to go ahead and register for antenatal care, but take more precautions as you are now more vulnerable, as your immune system is not as strong as it used to be. You can also view my previous video on why the world fears COVID-19 to know how to protect yourself. I'll take you through all the trimesters in pregnancy so that you can know what to expect and what is normal, abnormal, or should be considered as an emergency. Remember that the list here is not exhaustive and it does not replace the advice and counseling you get from your midwives and doctors during your antenatal care visit. First trimester. This is the first to 13th week of your pregnancy, or the first 3 months, and here we get to see you every 4 weeks during your antenatal care visit. Morning sickness consisting of nausea and vomiting is experienced by most women. You may also feel tiredness, headaches, loss of appetite, excessive salivation, sensitivity to odors, and weight loss. This is as a result of changing your hormonal levels and your body trying to adjust to the new condition. However, in some cases where there is excessive vomiting, a condition we call hyperemesis gravidarum, the woman may get to be hospitalized for rehydration so that we can avoid severe dehydration and possible unconsciousness. During this period, we examine you to check if you're pale or dehydrated, check if you have swollen feet, to examine your abdomen, your vaginal region. We do systemic examination, we check your blood pressure to make sure you're not hypertensive, and check for any other abnormality. We also calculate your body mass index using your height and your weight to check if you're underweight or you are obese. Routine drugs like folic acid and fesolate can be commenced during this period, but most medications are actually avoided as they can alter the sequence of formation of the baby's organs, leading to an abnormally formed baby. This includes antibiotics like tetracycline, antihypertensives like lisinopril, drugs used to treat arthritis like methotrexate, anti-epilepsy drugs like valproic acid. All these should be prohibited. Always inform your doctor if you're already on a medication or you're about to start one. Blood tests are carried out like PCV to check your red blood cell volume, because many women are prone to being anemic as the pregnancy progresses. HIV, syphilis, hepatitis B and C tests are also done. Women who are HIV positive are immediately started on highly active antiretroviral therapy to prevent their babies from coming down with the virus. Blood groups and genotypes are also done, and if you're a rhesus D negative mother and your partner is rhesus D positive, like you have a blood group O negative, B negative, A negative or AB negative, please be informed that you're going to receive an injection called Rogam, and this is given within 72 hours after delivery or if you bleed during your pregnancy, and this is to protect your future pregnancies from miscarriage. Your urine is also checked, usually for the presence of protein and glucose, and if they are raised, they are usually indications of certain illnesses. This is the best time to do your first ultrasound scan to enable us date your baby and for you to also see your baby's racing heartbeat to confirm viability. Second trimester, the 14th to 26th week or 4th to 6th month make up this period, and during your antenatal care visits we usually see you every 2 weeks. Experiences here include increased appetite and cravings. Weight gain occurs markedly during this period as your body undergoes physiologic, endocrine, metabolic changes in order to provide growth and development for your baby. You may gain between 11.5 to 16 kg. Generally, you are underweight if you weigh below 45 kg and obese if you weigh over 90 kg. Stretch marks may begin to appear on your breast and abdomen as your skin is undergoing tension due to the unveiling of your baby bump. The mask of pregnancy known as cloasma, which is seen to be darkening of the skin on your forehead, bridge of your nose, and your cheeks, may begin to appear from 16 weeks, and it's usually worse when you are exposed to sunlight. The first dose of your tetanus toxoid medication is given during this period. You receive it intramuscularly. You are expected to receive 5 doses. After receiving the first dose, the second dose is given 4 weeks after the first dose. The third dose is given 6 months after the second dose. The fourth dose is given 1 year after the third dose, and the fifth dose is given 1 year after the fourth dose. Please remember to receive the 5 doses of your tetanus injections to protect you for life against the tetanus bacteria. Between 16 to 22 weeks, you will get to feel the first kick of your baby, and this is called quickening. Intermittent preventive treatment for malaria prevention using sulfadoxine pyrimethamine is commenced during this trimester after quickening. You are expected to receive 2 doses at least 4 weeks apart. For women that are HIV positive or sickle cell, you are expected to receive 3 doses. A blood glucose test known as OGTT is done if glucose is found in your urine, or you have a family history of diabetes, or you are obese, or you're carrying multiple pregnancy. This is to check if you have gestational diabetes, as some women usually experience this during their first pregnancy, and it comes with its complications. Calcium supplements may be started in some centers during this period. The sex of your baby is well defined during this trimester. An anomaly scan may be done at 22 weeks to check if your baby has any abnormality. Third trimester. This is from your 27th to 40th week of pregnancy, and it's usually between your 7 to 9 months. With increased pressure on your bladder, most women experience frequent urination. Stretch marks, skin pigmentation, and low back pain may increase. Swelling of your ankles, hands, and face, known as edema, is common and is a natural consequence of the hydrostatic changes in your lower body circulation, as long as you don't have protein in your urine with a high blood pressure. Your skin may become dry and itchy, and you may begin to feel heartburn. Your sex drive may also reduce. You may find it difficult to assume a sleeping position, but always lie on your left lateral position, as this is the safest for you and your baby. Your breast size increases, and colostrum, which is the first highly nourished milk, may start to leak from your nipples. There may be development of spider and varicose veins with increase in blood flow. The second dose of sulfadoxine pyrimethamine is usually taken during this period, but not after 34 weeks. And this is to prevent the baby from coming down with jaundice and possible brain damage, what we call kernicterus. The last ultrasound scan is done here. First, to determine the final positioning of the placenta, because if you have a low-lying placenta called placenta previa, depending on the degree, you may be booked for an elective cesarean section, because this already obstructs labor, as there will be no passageway for your baby to come through. Secondly, to check for the weight of the baby. This, in conjunction with a pelvic assessment, will determine if a woman can give birth vaginally. Because if a woman has a big baby called fetal microsomia, it may be difficult for the baby to pass through her pelvis, and this may lead to obstruction known as cephalopelvic disproportion, leading to prolonged labor. Thirdly, for the final positioning of the baby. Although the baby can keep turning up till 10, at the last few weeks of your pregnancy, the final position of the baby can be determined. And if the baby is presenting with his bum down, what we call bridge presentation, depending on the adequacy of your pelvis and other factors being put in place, your doctor may advise you on an elective cesarean section. Remember that there are warning signs that you must take note of, and it doesn't matter what trimester you're in, you are to report to your doctor. When you stop feeling your baby kick after quickening, any form of vaginal bleeding, a high blood pressure of 140 over 90 millimeters of mercury, a high blood glucose level of 11.1 millimole per liter or 200 milligram per dl, protein in your urine, glucose in your urine, breakage of your amniotic sac, a high fever, excessive vomiting, convulsions, marked abdominal pain or burning sensation during urination. These dozens of problems are usually not normal during pregnancy. Time for delivery. This is the period between 37 weeks to 41 weeks and 6 days. Any pregnancy at this point is called a term pregnancy. False labor, known as Braxton Hicks contractions, may be frequent during this period. You start to feel contractions that make you keep going to the hospital thinking you're in labor, but they just keep sending you back, telling you that no, you're not in labor. This is nothing to be ashamed of, because it is better to be safe than sorry. However, this can be largely prevented and reduced if you know the signs of labor. These are the presence of show, when your water breaks, and an intermittent contraction of your abdomen. However, the ultimate sign of cervical dilatation is confirmed at the hospital. It is usually assessed by the midwife or doctor during a vaginal examination. A lot of women hate this part of labor because they just feel we just show up and just start poking their vagina, and it can be very uncomfortable and painful. However, all this may not be present at the onset of labor, but can help guide you to differentiate between true labor and false labor. Two options are always available during delivery, which are vaginal delivery and cesarean section. All things being equal, a primary gravida is allowed to give birth vaginally. However, please listen to your doctors, as there are various indications for elective and emergency cesarean sections. These are all considered following your present state, the outcome of the pregnancy, and the presence of any ongoing illness. A vaginal cut called episiotomy may be given if your baby's head is stuck and is unable to come out. This is to avoid vaginal tears and to aid in easy delivery of the baby. This cut is usually stitched immediately after delivery. Remember, the joy of every pregnancy is in the delivery of a life-healthy baby to an life-healthy mother. Do well to drop your thoughts, fears, and questions in the comment section below. Thank you for watching. Remember to subscribe, and I will see you same time next week.